How did UnitedHealthcare UHC UHG become the one healthcare if they deny so frequently highest and have complex claims process? America touts privatize healthcare for their citizens, but I am 52 and I have never shopped around to find the best healthcare provider for myself. Nor have I ever known another American who has shopped around for their own healthcare provider. I have to take whatever healthcare provider my company chooses, which is usually the best healthcare provider for the company and not me. As people say, most folks are picking insurance from a pool offered by their employer. Also, most people don't have serious medical issues until they do. Your insurer might seem fine if they are reimbursing regular checkups. People don't experience the seriously impactful claim denials until some crisis pops up for the first time. You often can't predict what exact coverage you'll need, so impossible to shop with those future needs in mind. I'm an employee benefits broker. UHC has the best marketing. They know exactly how plans are sold, and they design their plans to compare favorably against the competition on a spreadsheet. They also know that the vast majority of people will only use their plans for routine care, and they design their plans so that those transactions are favorable. When you see a doctor or fill a prescription and you have a low copay, sometimes zero, you think to yourself, wow, I must have good insurance. They are very savvy about the superficial things that routine claimants notice. For example, their vision insurance network includes Warby Parker. Most don't, because it's pointless, because Warby Parker glasses are so cheap to begin with, you don't need insurance for them. But people like the brands, so when they see that UHC is the only insurance that covers them, they think it must be good insurance. A few years ago they had a program called Motion where they would pay you up to $3 a day if you got your Fitbit steps. People love it, employees talk, and we get calls asking how this program can be added to employer plans. We have to tell them it's exclusive to UHC. It's superficial marketing stuff like that. The fuckery enters in when claims get large. Because people often don't pick their providers. Employers do, and they largely decide that based on costs to them. So UHC gives them a deal, then makes up for it by screwing over the subscribers. It's reason 35,298,000 of why employment-based healthcare is such a bad system. Most people don't choose their own insurance. Companies usually form a group together to get a negotiated rate on their insurance for their extended business. Almost everyone gets their insurance plan from whatever benefits their employer offers. They got successful by paying fewer claims. Lower expenses equals higher profits. Even those who use the exchange's Obamacare have to choose from a list of options available in our state. Twice I had to change because my insurance companies weren't operating in my state anymore. Nurse here, I spend more time fighting with UHC than actually treating patients. They've perfected the art of denial by technicality. Wrong code? Denied. Missing a period in the documentation? Denied. They are not one because they are good, they are one because they are ruthlessly efficient at saying no. UHC serves a lot of states for Medicaid, so they make a fortune from state taxpayer money and then deny claims. Beyond that, as others have posted, they have a large number of participants because for the most part employers choose the provider based on cost. Usually for their employees, the participant doesn't get to choose in most cases. They often are the cheapest on the market, so employers like to choose them as the company health insurance provider. Since most people get their insurance through their employers, there isn't exactly much choice in who is your insurance provider. No, one in profits does not translate to no one in healthcare. Because insurance companies choose their customers, not the other way around. They all do this, but most don't have a choice. They pack healthcare with middlemen and set up elaborate disinformation systems. It's pretty impossible for the elderly to deal with, etc. Monetizing morbidity, they should call it. The fact that healthcare is tied to employment doesn't make any sense. They became so successful precisely because of those things. The less money they pay out, the lower their expenses, the higher their profits. Most people do not choose their health insurance, they get it through work. It's easy. You charge a lot for premiums and don't pay out a lot. Biggest, easiest scam in the world. All the major healthcare providers do it. Plus, they hand out bushel baskets of money to politicals on both sides of the aisle to make sure the US never gets single-payer healthcare, like 98 of the countries in the world. Because we don't get to pick our insurance provider, our employers do. It's probably cheaper for the employer, seeing as how it's shit. I make the insurance decisions as our small company. I have no clue which provider is better or worse when it comes to denials. I try to find the best price for our company and our employees with the best deductibles. There is no pressure or incentive on insurance companies to be the best, only the cheapest. They didn't get rich by writing a lot of checks,